Chapter 14, Major Minerals, Screencast 4. This will be the longest screencast for this chapter because it's concerned with calcium, and calcium is one of the major minerals that we have in great abundance within our bodies. And also, we have a very significant disease such as osteoporosis that is directly tied to calcium. Now, here, if we're basically looking at foods that are high in calcium, keep in mind it's a little bit all over the place. We see nuts, we actually see orange juice, and the reason orange juice is high is quite often it is fortified. If we look at some products that are actually high, it's not surprising to see that dairy products are relatively high in calcium. So keep that in mind. And as I noted, one of the things that I've noticed across time when reviewing diet analysis projects and my plate analysis is generally a significant decline in dairy, and that's going to indicate potential problems with individuals getting enough calcium in their diet. Now, one thing to keep in mind is when we are talking about the calcium that's found in leafy greens, it is actually bound to oxalic acid, so it is not really biologically available in that form. Now, here we're basically looking at the amount of calcium that's actually absorbed dependent upon the item, and we're looking at spinach and rhubarb, that's about 5%. Then we look at foods such as almonds, sesame seeds, beans, that is up to 20 to 30%. Dairy products, 30 to 32%. When we look at Chinese cabbage, mustard greens, turnip greens, about 40 to 55% of that will be absorbed. And then when we look at substances such as Brussels sprouts, broccoli, kale, cabbage, and cauliflower, anywhere from 60 to 70% of the calcium in these foods will actually be absorbed. Now, calcium is very commonly supplemented, especially with older women. The most common type of calcium is calcium carbonate, and that is a supplement that actually has the highest proportion of calcium. Some supplements will also contain vitamin D, and that is to boost absorption of calcium. Calcium supplements are absorbed best when doses do not exceed 500 milligrams and administered during or just after a meal. Now, calcium is best absorbed in the upper part of the small intestine when calcitriol, and remember that is the active form of vitamin D, is present. This counts for about 25 to 30% of absorption. During periods of growth, this absorption may reach as high as 75%. Now, there are a number of conditions which will result in the reduction in the amount of calcium that is absorbed. Examples would be a reduced secretion of stomach acid, someone that has chronic diarrhea, phytic acid and fiber, oxalic acid, dietary phosphorus, polyphenols, and also malabsorption of fat. So all of these will have a negative impact on the absorption of calcium. Now, calcium is transported in the blood, either free or bound to proteins. And if we look at where most of the calcium is found in our body, unsurprisingly, it's the skeleton and teeth, and that holds more than 99% of the body's calcium stores. Now, it is important to keep in mind concentration is tightly regulated by hormones, and we're specifically talking about blood levels of calcium. Now, parathyroid hormone is a hormone that will be released when blood levels of calcium are low. Parathyroid hormone will act on the osteoclast cells and bone, and that actually will release calcium ions into the blood. Parathyroid hormone also acts on the kidneys to conserve calcium and form calcitriol. And calcitriol acts on the small intestine to increase the absorption of dietary calcium. When calcium levels are high, the hormone that comes into play is calcitonin, and this is released from the thyroid gland. Calcitonin acts on the osteoclast cells to inhibit calcium release while stimulating the osteoblast cells. Calcitonin also acts on the kidneys to increase the excretion of calcium in our urine. Now, prior to taking an anatomy and physiology course, you probably didn't think a lot about the role of calcium in our body, but it really does have a number of very diverse functions. Calcium is required, unsurprisingly, for the development and maintenance of bones and teeth, but it also is necessary for blood clotting, the transmission of nerve impulses, specifically synaptic transmission, the contraction of muscle, and also cell metabolism. Now, first, let's take a look at the role of calcium when it comes to the development of bone and maintenance of bone. Bone consists of a number of proteins, fibers, collagen, and minerals. Calcium and phosphorus are the primary minerals, and together they form what's called hydroxyapatite, and this is what actually will bind to collagen. Compact bone, that is the outer dense shell of bone, whereas spongy bone, also known as trabecular bone, and we can see that over here, is the inner hard spongy network. And keeping in mind here, minerals will move in and out of bone here, primarily the spongy bone. Now, one thing to remember here is the fact that bone is constantly undergoing a process called remodeling. Bone, along with muscle, is a tissue that I like to refer as being plastic. And what plastic means is these are tissues that respond to external forces. So we can load the skeleton with impact forces, or it can be not loaded due to sedentary behavior and things such as that. Now, when we look at the types of cells that function in bone growth and remodeling, there are osteoblasts. Those are the cells that actually build bone. We have osteocytes. They are biochemically active. Think of them as mature cells. And then we have osteoclasts, and they play a role in bone reabsorption. And remember, those are the cells that are stimulated by parathyroid hormones and 1,25-OH2 vitamin D. Now, here we basically look at maintaining calcium balance in adults, and notice we look at a dietary intake of approximately 1,000 milligrams. Within the intestinal tract, approximately 300 of those milligrams will be absorbed, and 700 is actually unabsorbed. And then we basically look as far as blood calcium, and that is actually going to make its way to skeletal calcium. And that's where we're typically 500 to 700 milligrams that are readily available. We may lose some calcium in our sweat. And also, if we kind of look at what's happening as far as the kidneys. And so we can lose up to 140 milligrams in our urine, but notice how much is actually lost in the feces. That accounts for about 850 milligrams out of that 1,000. Now remember, it is not 700 because about 160 milligrams is coming from digestive juices and are sloughed off intestinal mucosal cells. So here we basically see the role of balance, and basically what goes in pretty much comes out. Now, when osteoblast activity exceeds osteoclast activity during times of growth and when bone is put under stress, keep in mind, I'll use the term loading the skeleton. Calcium recommendations are especially high during these times. Bone remodeling is a process that is ongoing throughout our adulthood. When we reach middle age, osteoclast activity becomes more dominant, and this can result in 25% bone loss and osteoporosis. Women can lose much more when estrogen levels fall during menopause. Now, calcium also plays a role in blood clotting. Calcium ions participate in the enzymatic cascade that leads to fibrin. Remember, it's involved in the transmission of nerve impulses to target cells. Nerve impulses are transmitted across the synapse at the end of the nerve. Impulses actually cause calcium to flow into the nerve, and this is the process that ends up releasing neurotransmitters from synaptic vesicles within the synaptic knob, and that will carry impulses across the synapse. If there is not enough calcium, something known as tetany can occur. Now here we can basically see the role that calcium plays with respect to the release of neurotransmitters. So first notice we have the action potential, and that action potential results in the opening of these voltage-gated calcium channels. That calcium migrates, makes its way to the synaptic vesicles. That neurotransmitter, which is located within the vesicles, will be released through the process of exocytosis, and then that neurotransmitter will diffuse across the synapse and bind to the target cell. Now, it also is involved in muscle contraction. So remember, calcium is released from intracellular muscle stores when stimulated by a nerve impulse. And it also permits the contractile proteins to slide along each other, which leads to the contraction of muscle cells. Remember, one of the important things that happens is calcium binds to the protein, troponin, and that actually will free tropomyosin and allow cross-bridging to take place. It also plays a role with respect to cell metabolism, and this is calcium enters the cell, it binds to calmodulin, and this complex actually activates intracellular enzymes, initiating an enzymatic cascade. Here we can actually see how it plays a role in the initiation of the breakdown of glycogen. Calcium is released from the endoplasmic reticulum, and this is in response to hormones or neurotransmitters. And now we have that activated calmodulin calcium complex, and this will result in an increase in intracellular calcium concentration and basically result in the activation of an enzymatic cascade. Now, when we look at the primary disease that is associated with calcium, it is osteoporosis. When calcium intake is insufficient, calcium is withdrawn from the bones to preserve the other functions of calcium. This can result in osteoporosis. Now, this is a disease that is diagnosed when bone loss and strength decline. Bones become fragile and are very likely to break. Those most likely to fracture are the hip, the wrist, and vertebrae. Quite often, you've probably seen that kyphosis, which is that increased abnormal curvature in the upper back, and that is actually due to compression fractures in the vertebrae. Here we can actually see the damage created by osteoporosis. The bone that is most susceptible to this is spongy or trabecular bone. Now, the highest rates of osteoporosis are seen in Caucasians and Asians. Generally, this is identified with a dual energy X-ray absorptiometry or DEXA scan. Remember, we talked about DEXA scans as the most accurate way of measuring body composition, and this is what is currently used to determine whether bone density is normal, low, or very low. Now, here we look at the relationship between peak bone mass and the risk of developing osteoporosis. One of our goals is to actually maximize the amount of calcium we have in our stores. And this is really important because it's all about bone mass. And I like thinking of having a bone bank. As we get older, we are going to lose bone. There's no getting around it. But if we have more in our bone bank, then we are in a better place and won't be as impacted as much when we start to lose bone. This is especially important in postmenopausal women when their risk for osteoporosis is greatly increased due to the fact that they are no longer producing ovarian estrogen. Now, there are a number of strategies in which you can actually prevent osteoporosis. One is diet. You should have a diet that is high in calcium, vitamin D, magnesium, phosphorus, potassium, vitamin K, and protein. Also, weight-bearing activity is very, very important. And the more impact, the better. And there is plenty of evidence showing that loading the bone with high-impact activity is a very effective way of increasing bone mass. People should avoid smoking. Also, when we're looking at our diet, we should be eating less meat, desserts, fried foods, alcohol, and sweetened beverages. So these are all things we should be not consuming as much anyway. Now, I'm not going to go through this whole list of factors associated with a higher risk of osteoporosis, but this is something that you might want to make yourself familiar with because I know there'll probably be a short answer question specific to what are factors that are associated with a greater risk for osteoporosis. So one of the big things is a genetic component. So history of osteoporotic fracture in a first-degree relative. So basically a parent or a sibling. a small, thin skeletal frame, advancing age, too little estrogen in women that are caused by menopause, especially in Caucasian and Asian women. Amenorrhea, this is actually the cessation of normal menstrual periods. This basically is indicating low levels of estrogen or someone that actually has had their ovaries removed. We've already talked about smoking, okay? But once again, I'm not going to go through all of these, but it is important that you are familiar with some of these because you may be asked to identify what are some factors that are tied in with a greater risk of osteoporosis. Now, when we look at the clinical perspective and medical therapies that can actually decrease bone loss at menopause, for a time they actually used estrogen replacement, but that is no longer in favor due to the fact that it increases the incidence of breast cancer and other cancers predominantly found in women. There are drugs known as bisphosphonates. There are selective estrogen receptor modulators, and also they can be administered calcitonin or parathyroid hormone. So these are all medications that can be used to actually slow down the rate at which bone loss is taking place in postmenopausal women. Now, there are some other potential benefits that are associated with calcium. It may protect against colon cancer, the formation of calcium oxalate kidney stones, and also there is some evidence that it will combat high blood pressure. Now, when we are talking about calcium intake, the upper level should be about 2,500 milligrams per day for adults 19 to 50 years of age, 2,000 milligrams per day for individuals over the age of 50, and this is based on the potential for increased risk of developing kidney stones and hypercalcemia. Excessive calcium intake can also cause irritability, headache, kidney failure, and decrease the absorption of other minerals.